to abdominal hernia repair, measuring defect length for CPT coding. An abdominal hernia is a protrusion of the abdominal contents through an acquired or congenital area of weakness or defect in the muscles of the abdominal wall. There are several types of abdominal hernias. Abdominal hernias are sometimes referred to as ventral hernias, meaning a herniation through the ventral or frontal abdominal muscles. Epigastric, umbilical, and Spigelian hernias are identified based on their location, and incisional hernias are categorized by their association with the previous surgical incision. To view helpful illustrations of the anatomy of the anterior abdominal wall, please visit the URL listed here. Beyond type and location, hernias are further specified according to their status as reducible, incarcerated, or strangulated. A hernia is reducible when the structures protruding through the abdominal wall can be manually pushed back into place. An incarcerated hernia is one that is not reducible, meaning the abdominal contents cannot be returned to the abdominal cavity through manual pressure. A strangulated hernia is an incarcerated hernia to which blood supply has been diminished or cut off, leading to death of the incarcerated abdominal contents. CPT codes 49591 to 49618 are used to report repair of any type of abdominal hernia, such as epigastric, incisional, ventral, umbilical, and Spigelian, via any method of approach. Implantation of mesh or other prosthetic device is included in these codes and not separately reportable when performed. The defining factors in selection of these codes are whether the hernia is documented as initial or recurrent and the total length of the hernia defect. Codes are available for repairs with lengths of less than 3 centimeters, 3 to 10 centimeters, and greater than 10 centimeters. Total length of defect for hernias classified as initial should be calculated separately from hernia defects classified as recurrent. The guidelines for measuring defect length direct assignment of one code based on the maximal craniocaudal or transverse distance between the outer margins of all defects repaired, where craniocaudal means top to bottom and transverse means extending across something. Hernia defect length measurement is calculated in either the transverse or craniocaudal dimension, with the total length of the defects corresponding to the maximum width or height of an oval drawn to encircle the outer perimeter of all of the repaired defects. Example A illustrates repair of a single defect whose craniocaudal length is 1.5 centimeters and transverse length is 3 centimeters. When repairing a single defect, code selection is made based on the maximum width or height of the defect. Since the transverse length or width of this defect is longer than the craniocaudal length or height, the CPT repair code will be selected based on a defect length of 3 centimeters. Example B illustrates repair of multiple defects. In this example, assuming all defects are either initial or recurrent, the length of the width, or the transverse length, of the oval drawn around the perimeter of the defects is 4 centimeters, and the length of the height, or the craniocaudal length, of the oval is 8.75 centimeters. Since the length of the height of the oval is longer than the length of its width, the CPT repair code will be selected based on the height, for a total defect length of 8.75 centimeters. Example C also illustrates repair of multiple defects which are all classified as initial or recurrent. In this example, the length of the width, or the transverse length, of the oval drawn around the perimeter of the defects is 7.5 centimeters, and the length of the height, or the craniocaudal length of the oval, is 6.5 centimeters. Since the length of the width of the oval is longer than the length of its height, the CPT repair code will be selected based on a total defect length of 7.25 centimeters. The physician repairing the hernias should calculate total length of the defect based on these principles and document the length in the operative report. A query may be necessary if multiple defects are repaired and documentation in the operative report provides only the length of individual defects rather than the total length of all defects repaired. CPT has an exception to the guidelines for measuring the total length of defect when defects are separated by greater than or equal to 10 centimeters of intact fascia. In these cases, calculate the total length of the defect by summing together the lengths of the individual defects. In example D, summing together the length of the individual defects of 3 centimeters and 5 centimeters produces a total defect length of 8 centimeters. There are a couple of other guidelines related to measuring the total length of an abdominal hernia defect. First, hernia defects should be measured before the defect is opened. This is because once the defect is open, the fascia will relax, increasing the size of the hernial opening, causing a falsely elevated defect length. Second, if both reducible and incarcerated or strangulated anterior abdominal hernias are repaired during the same operative session, all hernias are considered as incarcerated or strangulated. This means reducible hernias will be counted together with the incarcerated or strangulated hernias when determining the length of the hernia defect. This is important because it affects which group of codes will be used to report the repair, and which code will be reported from that group based on repair length. As an example, if a patient has a reducible hernia 2 centimeters in length and an incarcerated hernia 4 centimeters in length, and they are separated by 2 centimeters of intact abdominal wall, the total length of the defect is 8 centimeters. Please pause the presentation and take a minute to review the documentation for this case example. Because this case includes only the length of each individual defect and not the total length of all the defects, the appropriate CPT coding action for this case is querying the provider for the total defect length. If a query is not possible, assign a code for the largest total defect length supported by the documentation by adding together the length of the individual defects alone. In this case, the defect length for the incarcerated hernia is 3.5 centimeters because this is the maximum width or height of the repaired defect. The defect length for the umbilical hernia is 3 centimeters, as the length of this defect is the same for both the height or the width. Added together, 3.5 centimeters and 3 centimeters produces a total defect length of 6.5 centimeters. Since at least one hernia was incarcerated, and because both hernias are initial, if a query is not possible, report code 49594, repair of anterior abdominal hernia, any approach, initial, including implantation of mesh or other prosthesis when performed, total length of defect 3 centimeters to 10 centimeters, incarcerated or strangulated. Thanks for watching. Health Information Associates is committed to providing educational products that help coders be their best. So be sure to check out the other presentations on the HIA YouTube channel, as well as our full catalog of offerings at hialearn.com. Happy coding!